Biochemistry is the study of the antibody the chemical reaction happen inside a living organism. The important biomolecule is the antibiotic reaction. Antibiotic classification mode of action penicillin, tropomycin, chloramphenyl, tetracycline, actin-myosin D, mutamycin C, palicin, antibody resistance, multiple drug resistance. The introduction of antibiotics. Alexander Fleming, 1881 1955, was physician, biological, and pharmacological Scotland. Declared pioneer in the use of antibiotics in medicine. Antibiotic antimicrobial substance produced by various microbial peak and synthesis chemistry, chemically which inhibit growth and development kill other microorganisms. Antibiotic Antibiotics are medicine that fight bacterial infection in people and animals. The killing bacteria making it hard for the bacteria grow and multiply. Chemical substance antibiotic produce microorganism or synthesis killed inhibit growth of bacteria treating the bacterial infection but not virus. The antibiotic can be taken in a different way. There should be the capsule liquid. The topically which is cream spray ointment the butterware cane to quickly high ointment eye drop eye those infection back enter eventually usually of more serious infection. The antibiotic treat the bacterial infection, strep thorite, urinary tract infection, and E. coli. The antibiotic come of bacterial infection. The many serious infection come here. The infection taking antibiotic when the not needed will not help you give side effects. Possibly side effects. The effects of it would be parts of your course of treatment. Treat viral infection. Antibiotic to work in viral infection. The flu, most throat, cold and running nose, even the message cystic, yellow or green. Common side effects: vomiting, severe diarrhea, bloating indication, abdominal pain, loss of appetite. The allergy reaction. So some of the allergy reaction antibiotic except penicillin and cephalosporin. The allergy reaction with mild or moderate. The causes skin of thin urea, sewage, cut, thickness of the thorax, the cause of breathing defects. Mild to moderate allergy reaction can usually try to take antihistamine. The antibiotic can cause anaphylaxis, the potential life-threatening allergic reaction. The medical emergency should be tried quickly. Warning or precipitation. The alcohol does not drink alcohol taken antibiotic for 48 hours refining system. Need additional contract suspended condom will taken written antibiotics. The other medicine. The warning precipitation. The antibiotic resistance longer than routine treatment infection. These cases many infection were caused with virus antibiotic very effective. The speed of killing the projection. The antibiotic also they become less effective. The emergency of subtract the bacteria that have developed resistant to many different antibiotics. The infection can be seriously silent. The use of drinking antibiotic coverage. The antibiotic amoxicillin, co-amoxicillin, clavitrin, and gentamicin, ciprofloxacin, metronidazole, the pathway negative uncorrelated tightened patterns of helpful of understanding the general patient. The important antibiotic, the bacterial infection, abdominal infection, the urinary tract infection, typhoid fever, skin infection, main tubular closures, diarrhea, cardiac infection, bone and joint infection, bone and joint infection, parental. The staphylococcal lumen disease, the antibiotic critical condition for our situation where are you escapably balloon in infection. Mechanism different antibiotic classes. Cell wall synthesis, nucleic acid synthesis. A mechanism of action example interferon bacterial cell wall synthesis. Penicillin, Staphylococcus, Carbonium, Monobacterium, Pseudopeptide. Infectin protein synthesis is 50 much subunit of the ribosome. Cordulate, Linosambil, Chloromepinal. Intubation synthesis, fluorosis and norafloxacin fertilization. Infection RNA synthesis, reformment. Inspection and diarrhea reduce activity, sulfonamide treatment. Trichotillomycin bacterial membrane, polymyxin B, polymyxin E, and collagen. For protein synthesis, 50 submutant macro chromosome, submutant cell wall membrane, polymyxin. Antibiotic reaction, penicillin, cephalosporin, microbial, the amoxicillin type of reaction. Antibiotic classification, cell wall, beta-lactam, beta-lactam. The penicillin, beta-lactam, cephalosporin, carpeptidin, non-pectin, pectin-lactam infection. Non-beta lactam, macrolide, amylocaloside, fluoroquinolone, tetracycline, sulfonamide. Classification antibiotic, penicillin, cephalosporin, macrolide, tetracycline, penicillin, amoxicillin, ampicillin, cephalosporin, citracillin, erythromycin, clarithromycin, catulamycin, tetracycline, doxycycline, monocycline. Overfull class antibiotic, beta-lactam, amylolide, cephalosporin, coadeine, catulamycin, sulfonamide, tetracycline, macrolide, disulfide, amoxicillin, cephalosporin, and liptobettate. Overfull classes of antibiotic reaction. The antibiotic classified chemical structure of mechanism action. Mechanism action primarily tertiary bacterial cell synthesis, protein synthesis, and DNA replication. Macrolide, fluorine, tetracycline, aminoglycoside, and glycopeptide collection of bacteria type of beta-lactam serpentuli. The class of antibiotic mechanism. Penicillin, example amoxicillin, cephalosporin by tetracycline, carbapenem, monobacterium, atramycin. Macrolipid and atramycin kit protein synthesis targeting 50S subunit of ribosome. Fluoroquinolone inhibiting DNA synthesis targeting topoisomers DNA scale. Tetracycline for of spectrum agent that inhibited protein synthesis targeting 150 30S ribosomal subunit. Ammonochloride inhibit protein synthesis binding of the 30S ribosomal unit. Used the cervix gram-positive infection of infecting cell wall synthesis after the use the mRNA. Sulfonamide, black bacteria folic acid synthesis. Athulum liptononase, protein synthesis inhibitor used of resistant gram-positive bacteria. Penicillin, beta-lactam antibiotic. Mode of action, inhibiting cell wall synthesis. The penicillin-binding protein PPR including transpeptide. Cross-linked peptide can lead in the pregnant cell well asthmatic into eventual bacterial layers. Peptidal layer cell wall. Streptomycin monoclonal antibody. Insipid protein in bacterial. Bind the involuntary 30S ribosome subunit. mRNA and the 30S subunit lead in the codon mixture production of plasmid protein in insipid insulin. Chlorophenol, mode of insulin protein synthesis, bind reversibly the 50S ribosomal subunit. Janssen peptide transfer to prevent the formation peptide bond. 50S ribosome subunit 23S RNA. Tetracycline, insipid protein synthesis back to the static. Terminal tRNA on the IH side acceptor to the ribosome complex prevent the addition of the new amino acid growing in the peptide chain. Target 30S ribosome subunit. Actinomycin, mode of action, insipid RNA gene transcription. Intercalated inserted DNA typically between the guanine and tryptophan vein. Disordered blood movement the RNA polymer chain, DNA template, top in the transmitted DNA RNA. RNA transmission RNA polymers. The DNA micromycin, metamycin DNA synthesis alkylating agent. Alkylating agent is a cross-linked completed DNA strand. Target DNA interstrand is a cross-cell linking. Polygon on ambiotrisin mode of action disruptive membrane permeability. Mechanism bind the applicable steroid mainly present in the fungal cytoplasmic membrane. Binding the force of spinal membrane bleeding leakage essential intercellular ion and molecular resultant cell death. Antibiotic resistance to the reduction of cross-cellular strand track begins to the kill them during the infection harder to treat. MDR reference respectable bacteria resistant to the list of agents that are more antibiotic category. The bacteria will service track looking part kill them, making the infection harder to increase the mortality. Global health that driven the messaging antibiotic human the agriculture. The bacteria conflict lead in the understandably lineage like a MRSA and track resistance back to tuberculosis. Mechanism bacteria resistant antibiotic track target of bypass in track first. Cases overpresent antibody patents not financed treatment, more infection control hospital, the lack of training. Spirit, resident spirit contaminated water, incidence of failure when the international will travel affecting of human and animal health. Impact, prolonged illness higher, medical costs and increased death. Multi-drug residencies. Multi-drug residencies are marked healthcare settings. The clinical important MDRO long and controlled care setting identify multiple resistant organism disease infection of preventive measurement to prevent MDRO. Overflow natural barrier catch. Multi-resistant organism. MDRO catches infection moderately healthcare cost of healthcare system. All MDROS staff education assignment to identify risk patient facility and training. Antibiotics were environment cleaning, co-card resident necessary. The cases infection MRO procurement toxic and mandatory over a patient of outcome. It's transmit of healthcare setting. Colonization, living without having activation infection. CDC notes a 50% reduction from residential colonization from there. The increase of individual risk of developing infection. Residents serve as a source of transmission to others. Colonization infection, which MDR colonization can be long period in time, the month result in the silent transmission. Common colonization side of MDR was actually crown rectum. How antibiotic resistance occurs. The antibiotic resistance is ability bacteria resistance kill the antibiotic. The bacteria antibiotics is period of resistance of other bacteria. How the resistance happen? That's a tracker resistance. Antibiotic kill bacteria catching the illness as well as bacteria protecting body from infection. Tracking resistant bacteria allow that take over. Some bacteria give resistance, other bacteria catching up more problem. Example antibiotic resistance pet. First only includes antibiotics that develop resistant bacteria against cold. Second, antibiotics are resistance of microorganisms to human intestine. The cyclic of the track resistance of bacteria. Another could problem is the track resistance of bacteria and bacteria remain in the human coat. Another only George said common and in the general co-immunity resistant bacteria. Pattern to go home. Prevalent resident bacteria, gram-negative and Acinetobacter pneumonia, E. coli, Pseudomonas, Klebsiella, gram-Staphylococcus S. pneumonia, Enterococcus faecium. Treatment or silence. MT or infection differ treat leading to increase moderately longer hospital stay, higher cost. Last resort antibiotic. First line track file. Cleanliness, suicide example. Triclosan polymyxin, collagen. Newer treatment option. The agent include the aravaicaline, a complete inter-abdominal infection.